Good evening, everyone. As we end 2 years of the pandemic, a once in a lifetime situation, it's a good time to pray that we have put the worst behind us and to recall our journey as a group through multiple variants of COVID. To those of us outside the healthcare industry and the municipal corporation, it is an important reminder of the challenges that you COVID warriors faced and overcame to save lives. This is a small thank you and a big salute to all of you for your colossal efforts. Our story begins sometime in early April 2020 when we realized that hospitals and healthcare workers were facing a monumental challenge. It would have been wonderful, of course, if helicopters had showered N95 masks and PPEs instead of flower petals in the early days of COVID. We wanted to help, but how do we begin? How do we know who needed what, and from where do we source the right material? A WhatsApp group for COVID relief for us was our answer, but we needed public hospitals to participate in it for it to work. With Professor Ritu Diwan, we approached Dr. Sanjana Agrawal, Dr. Rekha Bhatkhande and Dr. Neela Patwardhan for help. Dr. Aparna Hegre introduced us to Kama, St. George, Cooper, Rajawadi and other hospitals. Dr. Vinod Khade connected us to Ackworth and others. Dr. Neela Patwardhan helped us to connect to Sion, KEM and MARD. Dr. Avinash Saknure helped us to reach out to resident doctors at JJ, Nair and many other hospitals. Resident doctors not only carried the core burden of saving lives but were literally left to fend for themselves when it came to getting protective gear. In the early days, they not only worked crazy hours to save lives but were simultaneously working to source PPEs and masks. Working through a WhatsApp group helped us collate requirements and source supplies at optimum rates. It allowed us to move from the initial need for N95 masks, PPEs, sanitizers, oximeters and thermometers to body bags, disposable bed sheets, life-saving medicines, nasal cannulas and things we had no clue about. Along the way, we fought profiteering by medical suppliers through public interest litigation and bureaucratic red tape over who was allowed to buy PPEs. Soon, the group got a life of its own and expanded to over 30 public and private hospitals as well as donors and healthcare professionals. It evolved into a place to share knowledge and experiences, post requests, and also act as a support group to deal with new challenges. From hunting for N95 masks, reusing them by storing them in paper bags, to procuring the right PPE, finding hospital beds or expensive drugs like tocilizumab and remdesivir, or sharing information on donning and doffing them correctly, dealing with fogging of spectacles, the group posted issues and find solutions to a variety of issues. We also shared the pain and daily challenges that our COVID warriors who struggled with COVID infections themselves and the loss of colleagues and loved ones, not to mention the demoralizing effect of political games over dead bodies. In the early days of panic, Dr. Avinash Saknure told us about a non-touch digital OPD designed by the amazing Dr. Rangnath Jhawar. The first one came up at Sion Hospital and pretty soon we helped set them up at Nair, Kama, St. George, JJ Hospital and Bhabha at Bandra. When hospitals struggled to get their bed linen cleaned, someone came up with the idea of disposable bed sheets. When a distressing controversy erupted over the shortage of body bags and how bodies were being disposed, we were able to do two things: change the media narrative from the politically motivated nastiness that was unleashed and source body bags at amazing rates with the help of someone within the group. Then Mr. Iqbal came on the scene as municipal commissioner and things began to get streamlined and shortages of beds and medicines began to end. He brought in military precision to the setting up of COVID centers, and we now know how he put his job on the line to ensure that there were no oxygen deaths in Mumbai, unlike the horrors of Delhi. Every time this group needed something, we reached out to him, and the speed of his response has been outstanding and heartwarming. Moneylife Foundation salutes our COVID warriors and all those who have been part of this group and the journey as donors, supporters and guides. We hope we have been able to put behind us the horrors of the pandemic and the lockdown, and that it was only a once in a lifetime experience. Thank you all.